5.1 Write sentence to describe the work of the specialist in each branch of medicine. 1. Dermatologist. A dermatologist specializes in diseases of the skin. A rheumatologist specializes in trauma. A pediatric is a specialist in diseases affecting children. Obstetrics specializes in pregnancies. 5.2 Complete the table with words A, B, and C opposite and relate forms. Specialist, specialist, specialty. Practice, practitioner, practice. Consult, consultant and consultation. Assist, assistant and assistance. Graduate, graduate and graduation. Qualify, qualify, qualification. 5.3 Find preposition in C opposite that can be used to make word combination with the words in the box. A pathologist specializes in diagnosing diseases through examining cells and tissues. A pediatrician must enjoy work with children. An oncologist is interested in diagnosis and treatment of cancer. A physiatrist must be good at consulting. A neurosurgeon must be good with her hands. 5.4 Make word combination using a word from each box. Consulting firms, general practitioner, group practice, center, health center, internal medicine, and surgical specialist. 6.1 Make word combination using a word from each box. Associate specialist, house officer, on-call, provisional diagnosis, radio pager, word round. 6.2 Match the description 1 to 5 with the job titles A to E. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children's admitted to ward assist a consultant. Dr. Stewart has just started the second year of her foundation program, SHO. Dr. Singh has started his training as surgeon, especially register. Phillips has just graduated and is working in a large hospital in Birmingham. Charge. Dr. Miller is in charge of the medical staff in Brigham Hospital. PRHO or of house officer. 6.3 Are the following statements true or false? Find the reasons for your answer. A medical graduate becomes registered 2 years after graduation. False. The system of training doctors in Britain is called the Foundation Program. True. The name senior house officer is no longer in Britain. False. The consultant is usually the first doctor to see a new patient. False. When working in shifts, all doctors take turns to be on call. True. 6.4 Complete the test of PRHO describing her job. When I get to the car, the first thing I do is talk to the house officer who was on duty during the last shifts to find out if there have been any new admissions. Then in generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down later. Later in the morning, I admitted a new patient, which basically involves taking histories. On Tuesday, and Friday morning. On Tuesday and Friday morning, the consultant does her guard rounds, and I have to take sure I'm completely to uh, up to date on her patients after that. There are a lot of things to do, like reading up, regress form blood test, and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home, and then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. 7.1 Complete the sentence. When someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurses is clinical support worker. Someone who is not qualified but is able to assist nurses is a student nurse. A nurse who is qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is charge nurse. A nurse who works in the community and district nurse. Someone who answers the guard telephone is work clerk. 7.2 My work combination is a word or phrase French but carry out a procedure, change a dressing, check the temper, give an infection, remove suture. 7.3 Complete the sentence with the correct grammatical form of perform. The breaking, painless, and easy examination biopsy of the pancreas is a procedure last March. If the patient condition deteriorates, shall be an operation. If diagnosis of meningitis is suspected, a lumbar puncture must be a biopsy. Last year experiment a randomized double-blind group study. 7.4 Complete the sentence with the correct grammatical form carried out. Now attended an examination, a large study, unfortunately, few properly controlled trial tests, so forth. A number of study experiments are centered to look at the questions, advise the exam operation, and the patient may approve recovery. The procedure can carry out in the emergency department. Make word combination using a word from each box. Ambulance technicians, artificial limbs, food, contact lenses, health professional, intraocular pressure, occupational therapist, social worker. 8.2 8.2 Which allied health professional could best help the following people? A young unmarried woman who has just had a baby, social worker. A woman who is having difficulty using her right arm following a structural fissures. Someone who needs glasses, optician. A elderly woman who has had a below knee amputation, prosthetics. A man whose wife has Alzheimer's disease, occupational therapist. A man with fungal infection of his feet, a pediatric. A podiatric. 8.3 Complete the test. A prosthetist works with patients of all age as a member of a clinical team. Based at a large hospital, the patients may need a prosthetist as the result of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born without limb. Orthotists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim to enable the patient to lead a normal life at work and leisure. And artists often works in a clinical hospital of an outpatient service and also visit their center to provide a service for people with special needs. They deal with people of all age, for instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformity if damage any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. 9.1. Complete the table with word from A, B, C opposite. Verb and noun. Admit, mission. Assess, assessment. Discharge, discharge. Operate, operation. Refer, referent. Treat, treatment. 9.2. My word combination using a word from each box. Acutely ill. Assessment unit on duty. Referral letter. Waiting list. 9.3. Which hospital departments will be most appropriate for the following patients? A woman in diabetic coma, intensive care unit. A patient who has just had a radical prostatectomy, pregnancy ENA. A patient who is to have a skin lesion removed, day surgery unit. A man with a foreign body in his eye, emergency. A woman with treatment aversion, accident, and emergency. 9.4. Complete the draft on an informational leaflet for patients. Information for outpatients. When you arrive at the hospital, please tell the receptionist who will welcome you. Check your details and direct you to the waiting area. The length for your visit will depend on the treatment what you're going to have. You may need to have some tests such as an X-ray, which could mean going to another department, or maybe turn to other professionals such as physiotherapists or dietitians. You may need to visit the clinic if the staff at the clinic wants to see you again. Other appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as inpatient for day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your care. Point 1. Complete the sentence. Children over 60s and people with some chronic diseases do not have to pay private care in UK. Patients with mobility problems may be unable to go out, they are housebound. The average GP appointment is 10 minutes long. Care outside working hours is known as out of hours treatment. 10.2. Make word combination using a word or phrase from each box. Charge dressings, make appointments, perform a patient, refer, clinic, run, clinic, supervise staff, and take messages. 10.3 Which member of a peace team will be responsible of each of the following? Running a clinic for pregnant women with midwife, teaching a patient how to strengthen his broke leg, physiotherapist, letting the GP know that the patient can come to their appointment, receptionist, visiting a patient who has just returned home after her hernia operation, district nurse, carrying out check-ups on children in a poor neighborhood, health visitor, organizing a cover from an assistant doctor, practice manager. 10.4 Completed diary for Dr. Stewart's afternoon. To 2 o'clock, practice team meeting over sandwich lunch. 2 to 4 o'clock, afternoon surgery. 12 10-minute appointments. 4 to 4:20, coffee break. 4:20 to 5 o'clock, check with reception for messengers, deal with home visits, and repeat requests. 5 to 6 o'clock, paperwork, reference to secondary care, admit text, cell phone, telephone, calls to patients, pre-op medical examination. 6 o'clock, phone switches to OOH service. 11.1 Match these activities to the stages of medical education in the UK given an A opposite. Dissecting cadavers, undergraduate, keeping a log of surgical procedure observed and performed, postgraduate, working for 4 months in accident and emergency to experience the specialty foundation program, taking a 4 weeks attachment in obstetrics and gynecology undergraduate, taking an online course on recent developments in cardiovascular disease, continuing professional development. 11.2 Complete the sentence. Just before the final year, students have the chance to take an recipe in a hospital, their choice anywhere in the world. Problems-based learning contrasts with an approach where each subject is taught separately. These days, lectures are often interactive with regular opportunities for the students to ask questions. In clinical attachment, students learn how to treat and manage patients. Then, selecting modules can be a topic from outside medicine, such as foreign language. Dissection of cadavers is an important part for anatomic component. The medical school at the University of Edinburgh is one of the oldest in the UK. She is a consultant at the Royal, one of the leading pediatric specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topic in a small group with our lecturer. 11.3 Matched each of these activities to one of the components of the undergraduate course. Julie spent 6 weeks working in a small hospital in Himalayas, overseas elective. A group of students discussed together the possible reasons for abdominal pain after meals in a obese 44 years old male. Problem-based learning. A small group of students traced the pulmonary artery in a cadaver dissection. Others spent a month working in the pediatrics ward of the local hospital. Clinical attachments and learns how to take blood from an early patient clinical school. Juma chooses to study travel medicine in his fourth-year student selective module. 12.1 Complete the phrases with verbs from each box. Demonst- Demonstrate, accomplish, or how to do something. Supervise a training by ensuring she successfully complete her training. Deliver a course of a training program as a teacher. Provide a course or training program as a student. Assess progress or competence. 12.2 Match the two parts of the sentence. 5.1 is a doctor who has reached the highest level in the specialist. A clinical trainer is a consultant who reaches these sections. A clinical trainee is a consultant who provides training during periods of direct clinical care. A supervisor is a consultant responsible for the training program of a trainee. A medical a medical school is part of the university responsible for medical education. A placement is a period spent as a trainee in a hospital or in general practice. A college is a body of specialists responsible for delivering and assessing training in their specialty. A fellow is a specialist in the first year of foundation program. 12.3 Write in a full qualification of the doctor and surgeons. Mr. A. H. John Husband, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England, Dr. C. Dolly, Bachelor of Medical Science, Doctor of Medicine, and member of the Royal College and Physicians, Miss E. Eglis, Bachelor of Medicine, Bachelor of Surgery, and Fellow of the Royal College of Surgeons of England. Dr. E. Meriwether, Bachelor of Medicine, Doctor of Medicine, Fellow to the Royal College of Physicians. 13.1 What kind of registration may these doctors obtain? A newly qualified Spanish doctor professional registration. A newly qualified Nigerian doctor limited registration. A doctor who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registered post specialist registration. 13.2 Write the abbreviation of words. Any doctor who wants to work in the UK must be registered with the GMC, General Medical Council. Some overseas doctors must be passed the PLAB test before they can register professional and assessment both linguistic. Part 2 of the test consists of an OC, Objective Structured Clinical Examination. In any emergency, remember the ABC protocol: airways, breathing, and circulation. Before you can obtain specialist registration, you must have a CCT, Certification or Completion of Training. 13.3. Complete the text. My name is Musa and I come from Yemen. I came to UK about 2 years ago after graduating because Yemen is outside the EAA. I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice on other candidates, it would be that at consulting station you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialist pediatrics, as hospital now have to demonstrate that it is a suitable candidate from the EEA. Once I will complete my second foundation year, I should obtain a CCT, which will allow me to proceed to specialist registration with GNC and obtain a step on the road to becoming a pediatric consultant.